Objective data is the data direct or indirectly observed through measurements. So the purpose of the objective data is to perform the examination in an order that moves from a level of higher integration to a lower level of reflex activity. So there are 5 neurologic examinations. The mental status examination is to provide information about the cerebral cortex function. The cranial nerve evaluation provides information regarding the transmission of motor and sensory messages primarily to the head and neck. Next is the motor and cerebellar system that assess to determine the functioning of the pyramid and extrapyramidal tracts. Next is the sensory system that provides information regarding the integrity of the spinothalamic tract and posterior columns of the spinal cord and brachial lobes of the brain. And lastly is the reflexes. So there are 12 cranial nerves. The first one is the olfactory, second is optic, oculomotor, cochlear, trigeminal, abducens, facial, acoustic, glysopharyngeal, vagus, spinal accessory, and hypoglossal. In assessing the mental status, we're going to assess the level of consciousness of the patient, observe the appearance and behavior, observe the moods, feelings, and expressions, observe the thoughts, process, and perceptions, and lastly is observe the cognitive abilities of the patient.
So, these are the equipments for physical assessment.
So the first assessment that I'm going to do with my patient is I'm going to do the cranial nerve, which is the first one is the olfactory. I'm going to assess the cranial nerves. Then I will going to ask the patient to have the sitting position and then at your eye level, and then I'm going to tell the client to clean their nostrils to remove all the mucus or the dirt from the nose, and then after that I'm going to assess the nose if the patient can smell the alcohol. So the abnormal findings is that the patient would never smell the alcohol scent, but if the patient smells the alcohol scent, it is normal. Can you smell the alcohol, sir?
Yes.
Can you smell the alcohol, sir? So the patient or the client is correctly identifies the scent of the alcohol. So the second cranial nerve is the optic. So since we have no Snellen chart, I'm going just to say that what is optic. Optic is a use of Snellen chart to assess the vision of the eye, and then the normal findings is the client has 20/20 vision or OD to the right eye and OS to the left eye. So the next procedure will be the assessment 3, which is the oculomotor, and the 4 is the trochlear and abducens. So first one is I'm going to do the oculomotor. I'm going to inspect the margins of the eyelids of the client. And the next is I'm going to assess the trochleometer of the client, which is if there is another movements of the eye, or if the eye is dilated. Next is the procedure of the abducens. I'm going to instruct the client to look up the light and follow what movement I'm going to do.
We are gonna ask the question.
Okay. The next procedure that I'm going to do is procedure number 5 in cranial nerve, which is the trigeminal. So the first is I'm going to ask the client to clench the teeth, and then I'm going to palpate the temporal and the masseter of the client if the muscles are contracted. I'm going to hold the temporal and the masseter. And then next procedure is I'm going to test the sensory function of the client. I'm going to tell to the client that I am going to touch
the forehead by using a dull sharp, but for most, I'm going to use this comb, which is a dull thing or a sharp thing, and I'm going to put it on the forehead, and he will close her eyes, and then the client will tell me if she feels the sensation. Close the eyes, and I'm going to put the dull sharp on the forehead. Do you feel the sensation? So the client feel the sensation, and also in the first assessment, while assessing the temporal limb masseter, the client is bilaterally, the muscles are bilaterally contracted. So next, as I'm going to test the corneal reflex, so I'm going to ask the client to look away a while, and I'm going to hold a cotton to lightly touch the cornea of their eye, of his eye from both sides, and repeat otherwise. So first, I'm going to do it on the left side of the eye, and to the other side. So the normal findings is the eyelids blink bilaterally. So the next assessment would be the cranial nerve number 7, which is facial. I'm going to test the motor function and ask the client to smile. Please smile, sir. Okay. So next is I'm going to ask the client to frown or wrinkle her forehead. Okay. And next I'm going to ask the client to show her teeth. Next is I'm going to ask the client to puff up cheeks. Next is I'm going to ask the client to purse lips. Okay, and next is to raise his eyebrows. And lastly is close tightly against the resistance. So my patient has the normal findings, which is the movements are symmetric, and the abnormal findings is Bell's palsy. The patient will going to have a Bell's palsy if inability to close the eyes, or wrinkle the forehead, or raise the forehead along with the paralysis of the lower part of the face. So the next procedure will be the number 8, the cranial nerve number 8, the acoustic or vestibular. So I'm going to test the client's hearing ability in each ear and perform the Weaver's test and the Rhine's test. So first I'm going to perform the Weaver's test, that I'm going to assess the vibration of the client if he can hear equally in both ears. So I'm going to do the Weaver's test. Next is I'm going to do the Rhine's test. Also, I'm going to test the hearing on each ear of my client. So, the normal findings is that the client hears the words from 1 to 2 feet by Weaver's test and Rhine's test. So, if the abnormal findings would be the vibratory sounds and the lateralized to good ear sensorily lost. So the next procedure will be the 9 and 10. The 9 is the glossopharyngeal and the 10 is the vagus. So first, I'm going to test the function. I'm going to ask the client to say open mouth wide and say ah while I'm using the tongue depressor. As a tongue depressor, I'm going just to use a spoon to on the client's tongue, and the normal findings will be the ovula and the soft palate rise bilaterally asymmetrically on phonation. Next is I'm going to test the gag reflex. The gag reflex is by touching the posterior pharynx and with the tongue depressor, and the normal findings will be the gag reflex are intact, and some normal clients may have a reduced of absent of gag reflex. So next, I'm going to do the gag reflex. So, as the client, the gag reflex are intact. Next is I'm going to check the client's ability to swallow. So, by giving the client a drink or kind of drink, water or juice, to assess the that if the client is not suffering on swallowing the type of liquid. So as you can see in the video, the client swallows without difficulty and no hardness are noted. The next procedure in cranial nerve is cranial nerve number 11, spinal accessory. So the spinal accessory is I'm going to ask the client or the patient to shrug the shoulders against resistance to assist the trapezoid muscles. So I'm going to conduct the procedure. So, as normal findings, the client, there is symmetric and strong contraction of trapezoid muscles. The next procedure is the cranial nerve number 12. So, the cranial nerve number 12 is the hypoglossal. I'm going to assist the client's mobility and the tongue, and then ask the client to protrude the tongue and move it to each side against the resistance of the tongue depressor, and then put it back in the mouth. So as I'm going to use this as a tongue depressor. So the normal findings is that the tongue movement is symmetric and smooth and bilateral strength is apparent. So the next procedure would be the motor and cerebral systems. So first, my client will perform the task condition and movement and muscles. So the next procedure will be the loaded steps. Close the eyes. So the client has slightly swaying or is normal. The third one is the client we're going to perform the coordination. First, I'm going to perform the assessing light touch, pain, and temperature. First is I'm going to test the light touch sensation by using a cotton. Please. Do you feel any light sensation? Okay. Next is I'm going to perform a testing pain sensation by using a hair clip or hairpin. Do you feel pain sensation? Okay. Next is I'm going to perform the vibratory test by using this tuning fork. Do you feel any vibration? Okay. Do you feel any vibration? Okay. Next is I'm going to perform the tactile test discrimination and fine toe. First is I'm going to test the position sense of his hands. So, next is I'm going to perform the stereognosis that he will close his eyes and identify the object that I'm going to put on his hands. Okay. Next is I'm going to perform the graphesthesia. I'm going to ask the client to close his eyes and open his palm, and he will going to identify what I am writing on his palm.
4.
Okay. So the normal findings is that the client correctly identifies the touch of the object, and he identifies also the number written. Next is I'm going to perform the reflexes. The first reflex that I'm going to perform is the eliciting devices reflex. Do you feel any? Okay. Next is the eliciting the brachodialis reflex. Okay. Next is I'm going to perform the postular reflexes, which is called the triceps reflex. And then next is I'm going to perform the eliciating the patellar reflex.